Time now for Sunday House Call. Joining us this morning, Dr. Mark Siegel, Associate Professor of Medicine at the NYU's Langone Medical Center, also author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health.
And Dr. David Samadi, he's Chairman of Urology at Lenox Hill Hospital and Chief of Robotic Surgery there. Doctors, good morning as always.
Good morning. Good morning.
We start with a really important topic. It has to do with Alzheimer's. Get ready for this. They actually say that there's a new brain scan that can not only diagnose Alzheimer's in a living person, but can also track it as it's in your brain. I mean, Dr. Siegel, this sounds great, but it's also kind of frightening if you're told you have Alzheimer's, and they can, what, follow it?
Well, first of all, Eric, we're talking about a global pandemic here, an epidemic. The Alzheimer's Disease International is saying that Alzheimer's is now a global epidemic. They're expecting 14 million cases by 2050. It's on the rise. Now, this doesn't mean that everybody that comes to see me that's forgetful, that can't make daily decisions, actually has this. They might have a B12 deficiency. It might be stress. It could be their medications. It could be several different factors I have to work out.
What do we look for?
Well, we look for a consistent change in everyday behavior with decision making, especially with memory loss. You can't decide where you lose your car keys. You can't decide where you leave your car. It's a progressive problem. But here's the thing that this study showed us, and this is brand new information. We knew that beta amyloid is a protein that clogs the brain, and it's associated with Alzheimer's. We know another protein, tau protein, is the structure of the brain. It has to do with the brain, how it communicates from one nerve cell to another. That's implicated. And we now have a new imaging study that allows us to see that early on. Now, if we can diagnose Alzheimer's very early on, you notice I pronounced it right this time. If you get it early on, you might be able to put treatments in place before it fully develops clinically.
But then what I wanted to go to, Dr. Samadi, picking up with Dr. Siegel just said, is that, losing your keys, forgetting, these are kind of everyday normal things. So how do you know that you're not requesting this test in vain?
Look, this is obviously a clinical trial, and it's not out there for everyone at this moment. But I want you to know that over the years, as physicians, we've done an amazing job. You go through all of your training, and the whole goal of a doctor is to extend life. We're always working on quantity. Okay, so we fix the heart, we fix the cancer, we fix the diabetes, and our goal has always been, how do we push that to 70s, to 80s, and now we see people in their 90s. But we kind of fell behind in the quality of life, and this is what Alzheimer's is all about, is that there are people coming in their 80s, and they have this kind of symptoms. So wouldn't it be wonderful to be able to diagnose that like any other treatment? And that's what this is really about. And now you see National Institute of Health is putting close to $100 million, and they just released about $45 million for research to find out what biomarkers, what ways to find this early. This is prevention. So the tau protein that Mark is talking about is that you can give fluorescent tags, send it through the blood-brain barrier to the brain, and then you get these PET CTs imaging, and you will see where these proteins are. That's amazing. So if you have that, now I can tell you, for example, well, I don't want to use Eric, I use myself. At the age of 50, for example, wait a second, you're headed toward getting Alzheimer.
Wow.
What can we do? So what's the big message for a lot of people out there is that we are making small steps in the field of Alzheimer. We have to get on with this. And you know what another disease is that's going to become a problem? Osteoporosis is right behind this. It's a matter of wear and tear. As we get older, all of these are going to come on the surface. What I want people, and yesterday Eric did a great job with the whole stroke demonstration as to what we do. Our good Dr. Siegel gets a lot of tests on homocysteine. Now, nobody says that if your homocysteine is high, you're headed toward Alzheimer, but that's one of the common grounds with stroke, and you can do that.
That's inflammation?
That's absolutely. Okay. It's related to inflammation.
So, and then there are things that you can do. This is what our audience want to hear. L-carnitine, which we've spoken about, kind of slows down the process. Is it going to fix Alzheimer? Absolutely not. Vitamin B family, where Mark prescribes, vitamin B is actually very much involved in all cognitive behaviors, maybe slowing down the Alzheimer's. That's folic acid that, Eric, you talked about yesterday.
We were talking about that, and Mark, when I go to the doctor, do I say, give me that T protein thing that'll track my head? What do I do, and when is it right?
Not yet, but here's the point. We want that because all we can do now is wait till you already have it.
Right.
And we say, wait a minute, let's do some memory tests. Let's do some neuropsych testing. And by then, you're already on that road of not being able to take care of yourself. What can you do in advance? David was making some key points. Exercise has been shown to help.
That's right.
Brain exercises, using computers, staying active, fruit and vegetable diets, all of that has been shown to help. But if on top of that, we can find this before it happens, happens,
Absolutely.
we might be able to treat it.
It is
It's so important. I mean, it's such a debilitating
You
and
find
devastating for
people
many
that
families.
transform from being
Yeah.
almost normal to like really.
Especially for the loving caregivers who are out there, and you know who you are.
Absolutely.